right, identify yourself, please.
What are you doing?
I'm recording you.
Can't you ID? Here's my ID. From the Department of Social Services. I'm from the Department of Social Services.
I have a right to know who you are, and I want to identify you. What is your name for the record, and who do you work for?
I work for the Halifax County Department of Social Services.
And what is your name?
My name is Mrs. Foster.
And what about you?
I'm Miss Boyd with Halifax County.
Okay, what are you doing here at my house today?
Pretty much I'm assisting the co-worker with
A report
your
that
case.
came in concerning allegations of improper care. And basically the report is stating that report is stated that mom had baby on 3/15. Report is stated mom left shortly after having the baby, and the baby did not have all the tests performed after leaving the hospital. Report is stated the baby's blood sugar was low, 44. Report is stated the baby had an appointment with Dr. Dorsey, and the baby didn't go to the appointment. Report is stated mother left hospital on her own. Report is stated the families are Muslim, and the PKU test for the baby, the PKU appointment for the baby failed to go to the appointment.
Okay, so is it against the law to not go to an appointment when they make an appointment? First of all, we never agreed to go to any appointment. So is there a law broken here?
We have concerns about...
Is there a law broken here? Yes or no?
I can't answer that question. I don't know.
Well, then you need to go find out and then come back. That's what you need to do.
because pretty much when we get concerns, when somebody make a report to the agency, it's mandated by state that we have to come out and respond. We're not trying to harass you or anything like that, but we just need to talk with you about the allegations in the report.
For what?
That's pretty much.
Okay, so anytime
if it meets the definition of abuse or neglect, then we have to.
Does this meet the definition of neglect or abuse?
Yes, because the report was accepted.
Okay, so what is the abuse being taken place here? What is the abuse?
Not abuse, neglect.
Okay.
Some categories it falls under abuse, but your specific situation falls under neglect.
Neglect. Okay. So you're here to do what? Are you here to force me to go to this appointment?
No.
So what are you here for?
I'm here just to address the concerns that was reported.
Okay, so you address the concerns. I hear your concerns. Anything else I can do for you ladies?
Well, technically, when a report is accepted, we're supposed to come in and assess the situation of the home.
Have you heard of the Fourth Amendment of the Constitution, ma'am?
Are you refusing?
Yes, yes or no? Have you heard of the Fourth Amendment of the Constitution of the United States?
To allow us to come in and address the concerns?
Yes, I am refusing.
Okay, fine, thank you. That's it.
Thank you.
I'll just let my supervisor know. I don't know what the outcome of you refusing to the services would come to. I just don't know, because that's considered what is it when they
My child has an appointment on Monday to go see a doctor, to go get circumcised and get any test that he needs to get done. I don't need the very next day. My wife doesn't need to go to any appointment just because they said that she needs to go to an appointment. I'm a free human being. Do you people understand what free is?
Well, see, the thing is
do you understand what free is?
Yeah, we know what free is.
Okay, then. So that means I have the right to choose any doctor that I want for my child, and I can refuse or I can accept any type of treatment that I choose.
And that's true. We're not saying.
And I can refuse you to enter or anyone else enter into my home under the Fourth Amendment. Now, if you want to take this to the Supreme Court, I will sue you, and I will sue you, both of you. Okay? Now, I have nothing else to say. You have addressed your concerns, and I appreciate you addressing your concerns, because you know what? There are a lot of children out here that need help. This house doesn't have not one child that needs any help. Thank you. Anything else?
If he wants it. You want my card?
No, I don't need your card. Thank you.
Okay, I guess you'll be hearing from Halifax maybe based on the concerns.
Thank you.
Would you like this flyer just to...
I don't want anything. Thank you.
Thank you.
Thank you.
What you got going on, man?
What do you mean?
I just talked to them. They said you wouldn't let them in to talk to them.
Yeah.
They were inquiring about the child, the baby. Would you let them get a little information on them, on you and them?
No. Do they have a warrant?
You don't want to assist in any way?
They don't have a warrant?
They don't have a warrant, so they don't.
No.
You don't have to give anything.
Right, I don't.
But they were just wondering if you would to
make
make sure that the child's okay.
No, my child's fine. I explained to them that under the Fourth Amendment, I don't have to allow anyone into my home.
That's right. Protection against unreasonable search and seizure.
That's right. Absolutely.
That's right.
Yeah.
So you did say you were going to take it Monday anyways to the doctor, right?
Yeah, yeah.
So that's what I'm thinking. They don't really have anything to go on here. You said you're going to take care of it. You're taking care of it. So
right. I mean, it's not even a true. Did they tell you what the concern was?
It was about some test that's not mandatory, but
that's
they
right.
suggest or something.
Yeah.
I'm not sure exactly
what it is they take the child's blood, they put it on a piece of paper, a bunch of dots, and then they send it in. They test for like sickle cell and this, that, all these different things. This is not mandatory, so it's not neglect.
I got you.
It's very clear. She said something else about that his blood sugar was low. It was within the normal range. Okay. When a baby is first born, their sugar is always low until they get some sugar water or they get some breast milk.
All right.
So.
Well, yeah, you're absolutely right.
Yeah.
100%. I was just gonna come talk and see.
Yeah.
And get
I appreciate it.
Too, so
I appreciate it.
I'll tell them the same thing. You know, that they ain't nothing they can stand on. Right
yeah,
now.
that's right. That's right.
Because I agree with you. I don't see any neglect. It's not something mandatory.
That's right.
So I don't see any neglect here either.
That's right. Absolutely.
They just wanted.
They
to
wanted to
get
do
some
it.
info
Yeah.
and talk, just to make sure, but
yeah.
they don't have any right.
They don't have.
That's
That's exactly right.
Anyways, I appreciate it, sir.
Hey, thank you.
All right.
Take care.